Our next chapter deals with secondary assessment. Before we get into the different components of this chapter, there's some terms that we need to learn. So going to your slides, we're going to first talk about pulse. Okay, pulse is referring to the number of times that your heart beats in 1 minute. Okay, last week when we were checking our pulses and I was writing them on the board, your heart rate, your pulse, they both are referring to the same term. Okay, the next term that we have is respiration. Okay, respiration is referring to breathing. Okay, so it's how many breaths that you take in 1 minute. Our third term is blood pressure. Okay, when your heart is beating, it has to send the blood from the heart to everywhere else in your body, and the amount of pressure that is in the artery and the veins when that is going on is what we refer to as blood pressure. Okay, and these are terms that will need to be on your note cards. Temperature, you guys are all familiar with. We will talk about internal temperature. Okay, and we'll lead into a little bit more of this topic when we talk about environmental injuries, which is our next chapter. Okay. Next term is skin color. Okay, in this chapter we're going to learn about a few different colors that can indicate a specific condition that's going on with your victim. Okay, our next set of terms, we have pupils. Okay, pupils are referring to the black dot in your eye, all right, that contracts and it dilates when you need to allow more light into your eye or if there's too much, but it is also a sign that there is trauma, that you can see if a person is responsive with their pupils. We have state of consciousness. This is where we have to do our assess responsiveness in CPR. Hey, are you okay? Are they aware of what's going on? Do they respond when you call their name? That kind of stuff. The next one that we deal with is weakness of movement. Okay, are they able to move their left side of their body but not their right, which could indicate a stroke? Okay, different things like that. Then our last one is sensory changes. We're going to be dealing with some numbness and tingling. Are they able to feel? Have they lost sensation completely? Okay, and those are all things that are going to have to do more with our secondary assessment. Okay. Remember that secondary assessment is dealing with less life-threatening situations. It's kind of a slower pace. We have more time to sit there and evaluate the patient. We don't have to call 911 immediately. We have the luxury to take it step by step, figure out what specifically is wrong with the victim, and then figure out at that point whether you need to send them to the ambulance, call 911, or is this a situation that you can treat on site. So our next little section, we see what we call hips, hops, and HIT. Okay, and if you notice, we have H in all three of these, and they all three mean history. Okay, history is going to be the first part of a secondary assessment. All right, we're going to break that down in a second and see what that means. The next one that we see is I's and O's. All right, which means inspection or observation. Okay, that's going to be dealing with what you see on your patient. Okay. Do you see any swelling? Do you see that they are breathing funny? Okay. And then your last section is going to be dealing with what we call special tests or testing. All right. And that's a little bit more specific. Once you've narrowed down a couple different possibilities, it helps you determine what is really going on. Okay, and all these are different forms, a format to help you figure out what is going on with your patient. We use these in athletic training, with injury evaluations. When you go to the doctor, they use a similar format. It's basically just going to be a guideline to help you figure out what is going on with your patient, to help you start evaluating. So the first thing is going to be the history portion, all right? This is where you're going to ask questions about what happened. What brought you in here today? If they're coming in with a sprained ankle, how did you do that? Okay, that's where we see our mechanism of injury. Okay, you also are going to gain some information like Are they on any medication? Do they have any prior conditions? Their family history. You also have your basic information like their name, their sex, their age, okay? All of those basic questions that you're asked at the beginning of your evaluation fall under the history. You're not touching them. You're just asking those specific questions about what's going on. Our second category is observation and inspection, and these are helping us to figure out and determine what's going on with our victim. All right, we're a little bit more hands-on in this section. All right, you are using your eyes to figure out what you see, but then you also have to deal with a little bit more of your vital signs to figure out if we're having a problem with any of those. So our first one that we deal with is heart rate. All right, heart rate is measured in what we call pulse points. All right, and remember that we check our heart rate at our carotid artery, all right, or our radial artery. Okay, a normal heart rate for an adult or a teen is 60 beats per minute. Now, when we checked our own carotid pulse last week, I hope most of you fit into that category. Okay, you will notice that for a child, it does go up. All right, children's heart naturally beat faster. Okay, the older you get, the less heartbeats that you have per minute. Okay, but there are going to be some other factors that play a role, like medication that you take, how physically fit somebody is, any type of pre-existing conditions, are all going to change the way somebody's heart beats on a normal day. Our next category that we'll talk about in under heart rate is going to be talking about max heart rate. Okay, max heart rate refers to the maximum number of heartbeats that your heart will beat in a minute. Now, this is your heart working at 100%. It cannot take anything any more. Okay, so you're usually only going to get this in lab experiments. This is not going to be something that you experience with just your everyday exercising, okay, or having some type of condition, okay. And you figure this out by taking the formula 220 minus your age or the victim's age, and that gets your max heart rate. So in our class, we used the example of somebody that was 15. So you would do 220 minus 15 equals 205. If your heart is beating 205 beats per minute, that would be your max heart rate. Okay, keep in mind, resting is 60 to 80, so your heart would be beating almost 4 times as much. Okay. Our last section that we're going to talk about today is breathing rate. Okay, breathing rate refers to the number of breaths in 1 minute. Okay, you can measure our breathing rate by looking down at somebody's chest, or you can put your hand on your chest and feel how many times it rises. All right. You can see normal for an adult is going to be 12 to 20 beats per minute, okay, which is not a lot, but you're also at rest, so you don't need a whole lot of extra oxygen. All right. For just like with the heart rate, for a child, it does increase to 20 to 25 beats per minute. All right. You do typically breathe a little bit faster. All right, more times in a minute. And keep in mind, there are going to be a couple things that play a role in somebody's having a change in their breathing. Something that would make them breathe less than that 12 to 20 could be a head injury or a lung injury. Okay, they also can go into shock. When we go into shock, that means our body's starting to shut down. Okay, a term that you'll need for your note cards is dyspnea. Okay, dyspnea means difficulty breathing. Okay, we'll see pnea, P-N-E-A, is referring to breathing, and dys is referring to difficulty. Okay, there's lots of things that can make it hard to breathe. You can have asthma. You could be choking. You could have that breathing, that total or partial airway obstruction. Okay, and we have another term, and it is apnea. All right, so again, we see the P-N-E-A, which is referring to breathing, and then apnea refers to stopping breathing, okay, temporarily, all right? Sometimes you guys have heard sleep apnea, and that is where people stop breathing in their sleep, okay? And that's where we see that term apnea, all right? This is a serious symptom of a concussion, okay? It is something that we take very seriously, okay? The next time we pick up, we will talk more about the different types of vital signs.